I want to start by stressing that we are really conscious now that numerous countries and communities have endured many weeks of social and economic restrictions connected with the effort to try to manage the pandemic and also to ensure that transmission is kept as low as possible. But this has led to considerable hardship, which I will refer to in a minute. Now, many countries, possibly containing altogether half the population of the world, are trying to work out when and how they can lift the restrictions that have been associated with physical distancing so that their people can go on with their normal lives. Other countries are trying to decide whether to introduce restrictions, and there's what seem to be sometimes a balance between economic and social restrictions versus looking after public health. There's often seemed to be a trade-off there. And I'm going to tell you that I think there are a number of conditions that countries need to be able to be sure are in place if they're going to lift their lockdowns. There are 7 points that I'm going to mention, and I'm going to talk about each of them with a little bit of extra detail, just in order to make more sense of it. Occasionally you might see my attention distracted. That's just because I was not able to answer phone calls, but people are trying to contact me all the time. So I'll keep the phone off and I'll try not to answer it. The first requirement that we really need to have at the top of our minds, those of us who work for public health, is that our priority is trying to make sure that the pandemic does not harm lives in any large number, and that also the actions that are taken to try to contain the pandemic also don't harm lives. This is a new virus. It's the first pandemic caused by a coronavirus. And we're all learning all the time, and we're adjusting our strategies based on the best available evidence. What we do know is that the virus isn't going to go away, and that reintroduction of the virus into communities will occur even when the current outbreaks are suppressed and contained. So that means that before coming out of lockdown, there are a number of things that countries need to put in place. They need to take account of the reality that COVID-19, the virus, spreads very fast, and it's deadly. It's 10 times deadlier than the 2009 flu pandemic. The virus can spread more easily in crowded environments, especially those places where older people are residing. Some of those have become really extremely damaged, and there have been very large numbers of deaths reported. In some countries, the numbers of deaths in the homes for older people are beginning to tot up, and they are becoming extremely large. We do know that early case finding, testing of people, isolating those who have the disease, and caring for every case and tracing every contact is essential for stopping transmission. And that basic capacity is what's needed in place at all times to try to get on top of it. So before a lockdown is removed, it's important that, as far as possible, transmission of the virus is understood and, if possible, controlled. And that's the first requirement. Know where the virus is and try to control it. Secondly, there's got to be capacities in communities for this detection of people with the disease, ideally testing them, though that's not always possible, isolating them, and treating every case that needs treatment, and tracing the contacts. And this requires, as we've said in previous briefings, a high level of community organization, some kind of neighborhood health watch that can be applied in order to find those who are ill and enable them to get the necessary support they have. Without these kinds of neighborhood health watches or other community-based organizations, it's very difficult to know where the virus is and who it's affecting. The third requirement is that the risks of COVID in special settings like health facilities, like nursing homes, is minimized. We've got to be able to make sure that people working in health settings are not exposed to disease. We've got to be able to make sure that older people in their residences are not getting ill and unfortunately dying. The fourth requirement is that we've got to have capacity within workplaces to prevent people from getting infected. That means that wherever possible, there has to be physical distancing in the workplace. It means wherever possible, people in workplaces need to be as protected as possible, especially if their work means that they have to be up close to others. And we need to make sure that schools don't become places where there is transmission of infection, particularly when adults come to the schools to pick up or drop off their children. Fifth, we've got to make sure that importation of diseases, particularly at borders, importation of the disease, particularly at borders, is controlled. This is difficult when it's not clear whether somebody who's coming into a place is infected. And that means there will need to be, at border points, facilities for identifying whether people have the virus, or if those are not available, there may well need to be quarantine facilities at entry points where people can stay for 2 weeks to be sure that they haven't got the virus. And lastly, and perhaps most importantly, it's essential, sixth point, it's most importantly, it's essential that communities are fully educated about the virus and its risks, and that people are engaged and empowered to adjust to the new normal of living with COVID. Now, there are some features of this new normal that are worth talking about. We know that within any community, it will not always be clear who has the virus and who doesn't, and that there will be people who have the virus and are mildly affected, and that they may be able to pass it on. So in Southeast Asia after SARS, we saw how people everywhere took to wearing masks, partly to try to protect themselves, and partly also to show to others that they were taking the disease seriously. There are many countries now that are encouraging all their people to wear masks, but for both self-protection and for signaling their concern. This is particularly the case in India, and also in US. Widespread wearing masks has now started to be recommended by the Centers for Disease Control. In Europe, there are big debates about whether there should be widespread wearing of masks. First challenge is that the best masks, the N95 or FFP respirators, which can stop you from inhaling most particles, they are in short supply. And the position of the World Health Organization is that masks should be preserved for use by those who most need them, by health workers or those who are in close contact with people who might have the disease. They also need to be preserved for people who are themselves ill, to stop them passing on the disease to others. And so there's going to be wider wearing of face protection in the community. It should, I think, initially be using homemade masks and other such devices rather than taking the special and precious N95 and FFP respirators away from health workers. This debate about the role of masks is very widespread now, particularly in some European countries that are working out how to come out of lockdown. And then the seventh point is that all countries have to strike a balance between measures that address the mortality associated with the virus, as well as other diseases due to overwhelmed health systems, but also they need to be able to deal with the social and economic impacts of the physical distancing measures like lockdowns. We've got evidence that there is a very rapid increase in levels of poverty as a result of people in the informal sector and people on daily wages not being able to access income. And this is leading to a quick appearance of food shortages and food insecurity, and people unable to buy the foods they most need, particularly nutritious foods for their families and their children, like vegetables and fruits, and also dairy produce. And so the need to institute mechanisms to try to make sure that people have access to food, absolutely essential, and it has to be put in place quickly. And we have information now from many countries that there is a growing food security and nutrition crisis building up super fast that needs attention as well. So I'll just repeat the 7 points because I muffled a bit when I was talking. This is partly because I'm quite scripted today, but I think it's important that I follow the line. The first point that I said was transmission must be controlled. That means knowing where the virus is, trying to work out whether or not the virus is spreading uncontrollably, and doing everything possible to control it through physical distancing. If that's working, then you can start to consider releasing a lockdown. Second, health system capacities must be in place to detect, test, isolate, and treat every case and trace every contact. That means a high level of community organization with public health services supported by community organizations, and putting those in place requires rapid reinforcing of public health, which is going on during lockdowns in many countries, but needs to be really scaled up. Thirdly, there have got to be special efforts to minimize outbreak risks in settings like health facilities, to stop health workers getting infected, to stop patients getting infected, and in nursing homes or homes where older people are being cared for. Fourthly, preventive measures have to be in place in workplaces, in schools, and other locations where it's essential for people to go. Fifth, risks of importation at borders have to be carefully managed. Sixth, communities have to be fully educated, engaged, and empowered to adjust to the new normal. They've got to know that COVID isn't going to go away in the foreseeable future, that it's a highly dangerous virus, and that it has the capacity to kill very large numbers of people, including in poorer environments. And seventh, that countries at all times have to strike a balance between measures to address the mortality caused by COVID and other diseases due to overwhelmed health systems, as well as the social and economic impact. Every one of us who's working in public health has been humbled by this pandemic and by the damage it is causing. Every one of us knows that this is the biggest health crisis that any of us have been involved in throughout our professional lives. We've never known anything like this. We're having to work together. We see ourselves as part of the collective struggle against this virus. We're part of the extraordinary response to an existential threat. It is an epic, epic battle. And that identity is what's binding us together at the moment as health professionals everywhere. I think we've found the relationships between each other have been strengthened. We've really been building on past contacts. We're linking up together like never before. We're networking to try to make sure that we're all strong and that we are collectively involved in really, really doing the best we can. And we're sharing information. Sometimes we're sharing information that's quite private. We're sharing our hunches and our thoughts. And to do all that, we need to be able to trust each other. Trust is the most vital variable in the public health community these days. And by the public health community, I mean everybody who's working for people's health, whether or not they've got a qualification. Trust gives us our identity. Trust helps us build our relationships. Trust enables us to share information. And through working in this way, we build trust. But if that trust gets diminished because we're frightened, if that trust gets diminished because we're worried that anything we say might be used against us, then it immediately freezes us and it makes life very difficult. We're in a very challenging time in global public health right now. Public health experts feel themselves under attack. They're criticized for decisions they're making using the best of their abilities. They're criticized, of course, because those who want to get on with restarting their economies want to do everything possible to try to get back to work. And they start to question the advice being given by public health leaders. And they do sometimes do it very, very publicly. And in some cases, they threaten to actually sack their public health officials or to reduce their funding. And to do that right now creates a climate of fear. And in a climate of fear, it's very difficult for people to work together. I really urge everybody who is involved in public health to be strong at this time. This is not a time for us to be held back because we're scared of what might happen. We all know that there are going to be huge inquiries after this finishes. There will be, and that's how it must be, and that's how we expect it to be. But for the time being, we're saying to everybody who wants to call us to account, please do so afterwards. Please don't strike great fear into the public health community, because trust will go and they won't be able to work together. There really are 5 qualities of thought and action when we're dealing with a situation like this that we want to be able to remind everybody are useful. They are the qualities that we've developed in working together for living systems leadership here in 4SD. One of them is that we always are able to hold competing perspectives simultaneously, whether it's on the use of masks or timing of lockdowns, or on issues like herd immunity or closing of schools. We have to recognize that there are multiple contested viewpoints, mostly because we just don't understand much about this virus. We're learning about it every day. Some days we hear that perhaps immunity is not as good as we thought it was going to be, that people who have the disease seem to get recrudescence of infection, or they get infected again. We have to hold that in our minds as an uncertainty. We have to recognize that there are different people with very, very strongly held views, and we mustn't take against them because of those views. Secondly, we need to see the whole system differently to its separate parts. We have to recognize that there are a lot of details about this that need to be dealt with, whether it's access to PPE for health workers, or dealing with the possibility of asymptomatic carriers, or the, again, challenges about whether or not antibody test works. They are terribly important, but we've got to keep looking at the big picture as well as the small picture and trying to be able to deal with both at the same time. Thirdly, we have to really recognize that there is a rhythm and a pace to this pandemic that actually has its own trajectory, and that we have to try to feel into that whenever we can. It's no good us trying to strike a position that's very different to that rhythm. There are big anxieties in all countries now, in all governments particularly, but just how to handle this, and trying to work out what the rhythm and the pace in an individual country or an individual community is absolutely critical to working on what we can do. But yes, we must test the boundaries and sometimes stretch the envelope, because that really matters. Fourthly, COVID-19 is emerging against a backdrop of many geopolitical tensions within countries and between countries. And we have to recognize that this disease has to be looked at within the context of the environment where it's happening. We can't adopt a universal approach and say it's got to be applied everywhere. We've got to be able to match what we say and do to the context within which we have to work. And that's challenging right now. And fifth, we have to meet people right where they really are. We have to recognize that this is a global debate. There's not our paradigm that matters to everybody. How I see it is not how the person who's just across the street or just across the town or just across the country or just across the world sees it. And we have to try to find a way to connect with people, to recognize their personal stories, to build on their personal stories and use that when we're talking about it. And we always have to help people make sense of their own circumstances and avoid lecturing to them about how things really are. It's really tough, because especially given that every single radio or television program, every single podcast, every single social media post has some degree of reference to the COVID-19 outbreak, we have to try to find a way of connecting with the vast variety of different emotions that people have, their frustrations, their anger, their absolute consternation, their sense of where on earth is this all going. We have to be able to tune into that. And most importantly, we have to be honest and authentic. If we can't be honest and open and straight with people, and if we're frightened away from doing that, then we get into difficulty. So those are my opening remarks, slightly colored by some of the issues that I'm having to work with right now, and the colleagues that I worked with so terribly hard over the last few months are having to face up to. These are people who are working night and day, 7 days a week, and they've been working in that way consistently since the beginning of January. In the context of the current attacks on them, individually and collectively, in the media, and in social media as well as broadcast media, it's a really, really tough time. These people are brave. These people are really, really doing their best. They're trying to make sense of really uncertain information. And I would like all of us collectively to stand up for them and to applaud them in our hearts and to feel for them, because they are finding the present climate of attacks and vilification and demonization, even sometimes death threats, to be really, really difficult as they go about their work. Thank you very much indeed. I will now answer questions. I appreciate that they won't all be relevant to my opening remarks, and I just wanted to get what I wanted to say off my chest, because obviously this is a tough time, and solidarity, particularly among those of us who are all working on this pandemic, and solidarity amongst yourselves is the most important currency that we can have. So the first question, thank you for sending it, is what can people do in countries that don't have highly developed healthcare? We've been struggling with this one because most of the recommendations about this disease relate to what can be done in sort of ideal circumstances, and that's how the recommendations have to be. You can't easily give a recommendation from international bodies what should be done where things are not so good. But realistically, we have to be able to tune into the realities, as I just said, of where people are and the circumstances they find themselves. Let's consider the situation in Mumbai in India, where we've been listening to some of the people there who've been working so hard with their COVID outbreak. They haven't got widespread virus testing. They can do some testing, but it takes time to get results. But they can't test everybody who's got symptoms. So instead, what they have to do is to assume that people with respiratory symptoms, even if they're not directly due to COVID, actually might be COVID. And so they have to encourage everybody with respiratory symptoms at this time to isolate. And they have to isolate them in a way that's incredibly careful and humane, because there's stigmatization in many communities about people with COVID. So it's isolation on the basis of symptoms, and it's supportive isolation and not repressive isolation. Secondly, they have to make sure that anybody who's been in contact with these people is traced. But then we hear stories about how contact tracers in many communities are being attacked and sometimes being stoned. So therefore, we have to protect these contact tracers so they can do their job. That's obviously a problem that is faced in many countries. And we found in Ebola that our workers were sometimes stoned and even knifed. So we had to all the time work with local leaders and connect with them so that they could help us with things like contact tracing. We need to be very careful to find ways to protect health workers in poor communities. They don't have protective equipment, but they can't turn away patients. So we have to help them to improvise. I've heard stories of health workers, even in industrialized countries, where they haven't got proper protection with proper visors. They have to cut plastic bags and put them over their eyes to serve as visors. They've had to use hairnets instead of proper protection for their heads. They've had, not hairnets, sorry, again, plastic protection for their heads. And they have to try to do their best with makeshift aprons to protect their bodies. And they do need at all times to be enabled not to have to do long shifts in the heat when they're looking after people who are ill. They have to find ways to be able to treat people when they haven't got ventilators, they haven't got oxygen, they haven't even got these positive pressure pressure systems for encouraging breathing that was used by the British Prime Minister when he was in St Thomas's Hospital. They haven't got those, so we have to be able to help them with manual systems for being able to help people to breathe, to enable them to get the air into their lungs. And they have to learn the breathing exercises that many have been offering for ways of helping people who are struggling to breathe to be able to get air into their lungs. We have to help with isolation. Sometimes you can't have people isolating at home if they only live in one home. And anyway, it's hard to isolate if your water supply is outside, or if you have a communal latrine outside that several people use. So you have to find ways to enable there to be specific facilities for those who are suspected of having COVID. And you may even need to isolate not only whole households, but whole sections of communities. We ask people if they're using police or military to guard isolation, to be absolutely cautious when it comes to the use of live rounds, and to have no use of live rounds wherever possible for enforcing quarantine or isolation. We've already heard reports of deaths when actions are being enforced. We had those in Ebola as well. Please be careful. Please do everything you can to make sure that those who are enforcing isolation are extremely careful and sensitive with how they do it. These are the challenges that are faced in low-income settings. They're challenges that we're looking at very hard. We're going to offer in one of our forthcoming narratives, it's just about to come out, some suggestions for how this can be done in low income settings? Thank you so much for that question. The second question, how long do you think countries have to stay in lockdown before we can go back to normal? I'm getting asked that question often. And I have to say, you know, you can't put a time on it. It's not as though I can say to people in France, well, by the middle of May, this will all be over and everything will be able to go back to normal. We have to go back to those points I mentioned at the beginning. There are criteria for the release of lockdown, the 7 criteria that I mentioned. And I want to stress that it would be very, very, very unfortunate if people were pushed into releasing lockdown, if governments were pushed into releasing lockdown before they were really sure that the communities are able to cope with the probability, and I would almost say certainty, that the virus will come back and there will be restart of outbreaks. So it's this basic truth. Make sure your communities are protected as best they can be with whatever resources they've got. Then you can think about gradually releasing the lockdown. We've done a note on this. It's our narrative. I think it's number 17. It's available on the same website that you might have used to find the coordinates to get in on this call. Please have a look at that. And if you find there are things in there that make sense to you, let us know. If there are things that are unhelpful, let us know. Every country is now going through this challenge of how can we release the lockdown quickly, particularly so that poor people can get back to earning their income, so that essential services can get together, and indeed, so that social activities can restart. But please do everything you can to make sure that you've got the community level awareness, the community level defenses in place. Don't wait till you've got testing available for everybody who's suspected of having COVID. It's not going to be possible. The particular test that's used, the PCR test, is very difficult to scale up into large numbers. But there are other tests that you use to test for antibodies. They're not yet sufficiently reliable to be used on a large scale to identify people who've had COVID. So we can't depend on the antibody tests yet, though we hope they'll be available soon. And the virus testing is not going to be available in every community, despite the exhortation for test that's been disseminated. The reality is that what matters is that communities know about the symptoms of COVID, know that they've got to be able to help people to isolate. Businesses can play a vital role. If businesses know what the symptoms of COVID are and can enable the people with symptoms to isolate, that is very, very helpful, because unless their people with COVID are isolating, they're likely to have to close down sections of their business for quite a long period, because they'll have to have large numbers of people going into isolation. So enabling employees to isolate quickly is absolutely key. How long will countries have to stay in lockdown? Quick answer, until they know that their communities are ready to be able to handle further arrivals of COVID, and that they can then be properly organized to be able to isolate quickly and get on with the rest of life. And by the way, lockdowns will have to be reimposed from time to time when there are big outbreaks, but everybody concerned will do the best they can to keep those reimpositions as short as possible and to make sure that health services are able to cope with resurgent outbreaks quickly without health workers being endangered. Question 3, how can the impact of lockdowns be softened? Do we need to choose between restarting the economy and saving lives? When I'm asked this question, particularly by politicians who are trying to make decisions or those who are working with them, advising them on making decisions, I keep stressing it's not a choice between restarting the economy and saving lives. It's actually trying to do both at the same time, because you can't restart the economy if immediately that's going to lead to a massive increase in the numbers of deaths. Societies won't tolerate that. And so putting in place the defenses at the community level and the capacity in hospitals to deal with those who are infected is absolutely key. And that must be done during lockdowns. And it's tough for governments to do this. They've got their minds focused on other things. But I'm saying, use the lockdown wisely. Do your rebuilding of your public health services and strengthening of your public health services, recruitment of volunteers to support your public health services during the lockdown. That will make it much easier to restart. And yes, do soften the impact of your lockdowns by making sure that cash gets to poor people. Use cell phone banking systems to move amounts of money. It may be relatively small amounts, like the equivalent of $100, but just amounts to go into people's bank accounts to help soften the blow. And think hard about people's realities. In this month, about 23rd and 24th of April, Ramadan starts. That's 1.8 billion people in this world have the most important religious moment of their annual calendar. And it's not just about fasting, it's also about the fellowship that comes in the evening when you have the meal after the sun goes down. But people desperately want to get the food and other requirements they need to be able to celebrate Ramadan, even in the midst of this pandemic. They can't, like the English football season, say we'll suppress, we'll postpone Ramadan for 6 months or something. That's just not possible within the religion. So I'm encouraging every government everywhere to listen to their people very carefully, to try to find out where there is greatest discomfort, and then to make absolutely certain that they get cash to people who are suffering the most, and that they get food if they've got the facilities to do that. And remember that farmers may well be planting and doing stuff in their fields. Make sure they can do that, because otherwise the whole food system will be in big trouble in months to come. And do make sure that essential services can be kept going. Last and most importantly, protect people who are going to be stigmatized, protect people who are distressed, protect people who've got mental ill health, and particularly who are stressed as a result of this, and absolutely protect your older people, because they're the people on whom really we all depend, and particularly the wisdom of our people in so is important. So while you're doing your lockdown, if you're a leader, make sure you're listening to your people, make sure you're connecting with your people, because they need to hear from you. They need to hear that you understand that they're making massive sacrifices for the sake of getting this pandemic into some stage where we can contain it. And especially if you've started the lockdown early, as we've encouraged many governments to do, so that they can get on top of it quickly, please, please, please let your people know that you recognize the suffering that they're undergoing. It makes a huge difference. As I listen to leaders who connect with their people, and I've heard some fabulous examples from many leaders, from small islands to big countries, I am so impressed. That really matters at this time. It's a massive sacrifice by billions of people to try to get this pandemic under control. Question 4, what can be done about the increase in food prices recorded in some countries? I think many governments are saying, really, there should be no case for food prices to be jacked up just because those who are selling food believe that this is a good way to make money. Yes, there are problems of supply. Yes, in getting their supplies, merchants may have to pay a higher price. Well, that's when governments need to be very clear what's going on in the food chain. They need to be looking at the prices in different positions along the food chain. And obviously, if there's a case for prices rising, then that case has to be understood. But if there is evidence of really exploiting the situation to make money, or exploiting the situation to actually make lives for people difficult, then I would encourage authorities to come down on it very, very strongly indeed. I've been reading reports from a number of countries where governments have got very close watch on what prices are being charged and are actually trying to put a cap on the extent to which they can be increased. And that's important, but we have to remember that enforcing these regulations can be very, very difficult. So anything that can be done to collect information from communities about what is happening to food prices, but particularly of essential foods, let's hear about them and let's make sure they're public, not to me, but to local politicians and to local media, because it's through exposing these things that the challenges can be made clear. And within global media, myself and my colleagues, particularly my colleague Lawrence Haddad, who was with me on a number of issues related to food and nutrition, we're trying to get global attention to the reality of the food crisis emerging, but get it into the broader media and not just the food community. Question 5. What can and should be done? This is a tough question, I've just seen it, I'll read it slowly. What can and should be done to protect people in contained places, prisons, homeless people, hostels? And I would add ships, ships that are very, very contained. How can we be sure that they're not going to be exposed to a lot of disease and run the risk of dying? What is known from places that already experience this problem, and what may be applied elsewhere? Is mass release of prisoners a solution or another problem? Well, I've said already that within this crisis, governments are having to make incredibly tough decisions. Incredibly tough decisions. I want to keep stressing that. When I read sometimes the critiques being made of government leaders, I think those who are doing the critiques are doing so from the comfort of not being in a position where they're having to weigh up just such difficult choices with so many variables and often incomplete information. But one thing we do know is that people in contained settings, particularly those where there's crowding and not good ventilation, then there is extraordinary risk. And the risk is compounded if they need to be looked after by people who themselves are getting sick and who face high levels of absenteeism. So those who are at work are hugely stressed. And so this does mean that prisons and places of confinement are becoming really delicate places for dealing with COVID. Because we know of reports now of a number of prisons where there's widespread COVID infection, but also where those who are responsible for the prisons, the prison staff, who are very brave people, sorry, that sounds a bit political, the numbers of prison staff are also getting ill. And yes, they are very brave people. And when I hear about prison staff shortages and prisoners being incredibly frustrated because they're getting infected, I'm not surprised that governments have decided in many settings that it's better to release prisoners rather than to have massive riots with all the destruction that happens. We can't give advice on that, not people like me, but what we can do is we can sympathize with the very, very difficult choices that governments are having to make and the issues that people are facing. Because at the same time, we know that during lockdowns, we've seen reports of increases in violent crime, increases in robbery and theft. And so obviously there are dangers with prisoner release. And it's obvious, I suppose, but I think we have to emphasize that there are very, very difficult issues that are being balanced. And this is where the words of Michelle Bachelet, the United Nations High Commissioner for Human Rights, are worth listening to. She's been very clear. Every human being has human rights and they need to be respected. And I think that her advice on what's done in prisons is worth following. And those of you who are interested, do please check on the website of the High Commissioner for Human Rights. You might find it helpful. What we do know is that homeless people are facing a lot of difficulty. What we're hearing is that many governments and local authorities are introducing special facilities for homeless people. They're repurposing buildings to find accommodation for homeless people where they can have physical distancing. They're providing meals and other support for them, including medical services. And so I'm very pleased to hear that. What we also know is that places that have very low ventilation are more likely to have high COVID transmission. I include in that merchant ships, cruise ships, military ships. And although I'm not directly connecting here, I expect with people who are involved in those kinds of operations, we do need to understand that they're at big risk, and there are several thousand merchant ships on the seas at the moment that are not able to dock because ports are scared that their sailors are bringing COVID in. So not only are they experiencing high risk of infection, but they're also without places to dock, and that is making for a particular high level of anxiety. And I believe this needs constant attention, and anybody who's in contact with people who are in those areas needs to be aware that this is not a problem that's going to go away. It's one that we need collectively to solve. Simply saying ships can't dock, they've got to be left offshore, is not solving the problem. Question 6. Within the concept of the new normal, do you see this continuing until there is a vaccine that can be widely available? One of the challenges that I mentioned before, but which I think everybody ought to hold on to, is that we're not very clear what happens when people are exposed to the virus with regard to their development of antibodies. Yes, they develop some kind of immune reaction, but do the antibodies actually protect them against reinfection? And if they do, But how long will that protection last? And are all people equally protected? Or will some people be less well protected? These questions about immunity to COVID are there in the back of our minds when we think about vaccines, because a vaccine is taking an attenuated form of the virus and injecting it into us, and then allowing the body to develop antibodies against the virus with the intention that those antibodies will protect against further infection. We have a good vaccine against smallpox, not needed so much now, but it was very important for dealing with the virus. It was made from a different virus, cowpox, but it was used initially, but it was used to protect against smallpox. We've got other vaccines that protect against viruses like polio. But we've got certain viruses for which we don't yet have vaccines, including HIV. It was discovered 25 years ago. So we have to be a little bit careful about saying we'll be okay when there's a vaccine, and the vaccine should be available in 18 months. I know that there are fabulous researchers doing vaccine development, and they've got candidates already. I read a report from one in the UK, and I've read a report from another combination of two French companies that are developing vaccines, and they've got candidates. That's great. But what's necessary is for the candidate vaccine to be tested. Does it really work? Does it work in animals? Does it work in humans? And for how long does the protection last? And then, is it safe? For example, if the vaccine is given to somebody who's already had COVID, will that vaccine provoke a reaction that might actually be very dangerous? Or is the vaccine going to have other safety effects that we need to watch out for? Is it going to lead to some kind of morbidity or mortality that was unexpected? And we've all heard examples of vaccines that do have side effects. And so efficacy and safety testing is critical. This involves human trials in volunteers, then in populations, and then more widespread. And then the vaccine has to be manufactured in large quantity, and it has to be made available for distribution to everybody. And once it's distributed, then people have to be prepared to have it. And yes, that's, I think, a very real possibility, and everybody's going to work hard on that. And the best estimate is that can happen in about 18 months. But you know, we mustn't bank on that. And that's why the new normal, living with COVID, learning to adapt our lives to COVID, like we've adapted our lives to cholera, like we've adapted our lives to HIV, we've got to be able to do that and put that in practice and find ways of the new normal that enables us to go about our social relations and our economy really as long as it takes. And please don't let's imagine that it's only going to be 18 months. It could be longer. So thank you for that question number 6. Question number 7. Will the wearing of masks be part of everyday lives? Will they be worn by shop workers, by hairdressers, and by bus drivers? Well, I've read that in some countries, bus drivers are already wearing masks. Not in every country, but they're wearing masks because their profession has been associated with some very high infection and, unfortunately, death rates. I've heard that hairdressers are feeling that they need to wear masks because they have to be close. I've heard that people who do manicure already wearing masks because of concerns about the acetone from nail varnish. They're wearing masks now, all the more important because they're worried that their clients might have COVID. And I've heard that shop workers working in at the tills in supermarkets not only want perspex protection to protect them, but they're wearing visors and in some cases wearing masks as well. And I say, yeah, I think that's right. I think that's absolutely as it should be. It's as it should be because we know that people can have symptoms of this, they can be transmitting this virus even where their symptoms are not very severe. And they may not know that they've got COVID brewing up inside them. Possibly in the first day or two before you're actually sick with COVID, you may still be transmitting the virus. So I've been saying, we learned from Southeast Asia that people in the era of SARS wanted to wear masks. And that was important to them, both for their own well-being and as a sign to others that they were taking the disease seriously. And I don't think it'll be a long time before more widespread wearing of masks happens in other communities as well. I'm not recommending it, that's up to governments to recommend. But I think it may well go that way, and I wouldn't be surprised at all. And it makes sense to me. Question 8. Oof, another tough question. I'm glad that they're coming. What do you see travel will be like in the new normal, particularly internationally? Yeah. I've been talking to people who run hotel chains. I've been talking to people who run big conferences and exhibitions, as well as people who are involved in travel, whether it's bus or airlines. And I think they know that just as they had to reinvent how they manage airline travel after terrorist attacks and hijacking of planes meant that they had to look out for people who were carrying weapons, so they're going to have to adapt their system of working to the possibility that people who fly might have COVID. They'll be worried about the safety of their aircrew. They'll be worried about the safety of passengers. And also they'll be worried about whether the people they transport will be admitted when they get to their destination. It won't just be a case of whether you've got the visa and your passport. It'll be something much more than that. In some cases, people will be required to quarantine when they arrive at a new destination for 2 weeks. That's already happening in China, with people coming from abroad. And that's because the Chinese government know that the real danger in China is not COVID inside the country. In a way, they know about that, and they know how to close it down quickly. The real danger comes from importation of the disease from places where the outbreaks have built up hugely to an even bigger level than they were reported in China. So, yes, there's going to be a shift to international travel. It won't be the same. I think we might as well hold on to that. And I think that airlines will think very hard about what they do. Some airlines will go on flying. We're already flying. There are still 3 or 4 airlines that seem to fly out of Geneva Airport, which is almost deserted but not closed. And we'll watch them and see how they work and see whether or not they find that over time they have to adopt more cautious practices, or whether they're fine and whether their example can be applied to others. So let's watch it. Let's see what happens. But most importantly, let's encourage really strong international cooperation on air travel so that there is an opportunity for agreements to be reached as quickly as possible. That's where new standards will apply. Question 9. Are we already seeing the threat of a second wave of COVID-19 in Singapore? This is an ominous signal of what you've been warning us about. I know colleagues in Singapore, I hear them every week. They're amazing people. They went to part of the delegation of WHO to China to see what went on. They knew that despite the fact they'd managed to contain COVID first time round, they were going to get more cases coming from importations. They were super worried also about some of the capacities in Singapore for their guest workers, which involved people living very close together. So yeah, they were prepared. They don't call it a second wave. They just simply say re-importation. And I think that's the reality. This disease won't come in waves. It'll come in outbreaks that will occur all the time. And there will be multiple outbreaks. But the test will be whether or not the new outbreaks can be contained super fast, rather than perhaps waiting for 3 or 4 weeks to see whether they're building up and then say, okay, now we're better deal with them. But by that time, they're huge and they're overwhelming health services. The real test of countries will be whether they can contain outbreaks quickly, whether they're the second wave, third wave, fourth wave, fifth wave, or nth wave. There will be more outbreaks coming to countries that have got their defenses in place, that have dealt with their current big outbreaks, and it's dealing with those that's going to be the hallmark of societies of the future. Question 10. What can be done to curtail spreading of COVID-19 in developing societies where it's often impossible to practice social distancing? I am watching developing countries establish very effective community-level capacity to identify people with COVID and using the community structures they have to help people to isolate. Provided that local leaders are involved, incredible results can happen. And we've seen that already in many communities. They are going to need to be able to isolate sometimes households or even whole sections of society. That will be settlements in slums or settlements in townships, groups of houses, and to enable them to get what they need to survive, to get their water, to get their food, to have sanitation, and healthcare, whilst at the same time restrict their movement, particularly out of places where people have disease. It's going to be tough, but I think it's doable, and it's going to have to be done as well. I go to question 11. Are there WHO guidelines on pooled samples for large-scale testing forthcoming? There do seem to be possibilities being suggested in many countries of putting samples together in large batches for initial testing and then subdividing to get more fine-grained and individual tests where there are positive results. This is an incredibly effective way of using scarce testing and of trying to find out where the virus is. I believe that it's these kinds of imaginative approaches that are going to make a huge difference to how it is we can come out of lockdown, and also how we can maintain a constant view over where the virus is. This kind of pooled sample testing is a way of testing in the community, which makes the best use of testing resources. It's imaginative, it's innovative, and it's instructive. So yes, these things are coming, and I congratulate all who've been moving towards these kinds of imaginative solutions. What's the great thing about COVID? That there are millions of people working on imaginative solutions all at the same time. And what's great is the way in which they're all working together for the common good and trusting each other while they do it and seeing themselves as part of a great family. That's what's great. Question 12. There are reports around the world of increasing domestic and gender violence in the context of lockdowns. What strategies are being used to address this parallel epidemic? The statistics are clear. There's beating going on, and it's very violent. And it's of partners, intimate partners, women, and it's of children. And we know why it is. It's because people and men are incredibly frustrated with what's happening and angry, and they take it out on the person closest to them. We have to have ways of offering refuge. Yet many women's refuges and many children's refuges have been closed because of fears about the disease. I'm encouraging those who have hotels, those who have hostels, those who have apartment blocks, to open them up as hostels and refuges. I'm talking to hotel owners and asking them to do this, but I'm not the only one. Many organizations like Women in Deliver are doing the same. Let's keep raising the voice on behalf of women. You've got to have two things. You've got to have responsive helplines that work, that are easily accessible. If somebody just calls the helpline, it's got to be able to pick up where that cell phone signal came from, so that if it's snatched away from the caller, there's still some possibility of getting help. And secondly, there's got to be easy access and supportive help in these places of refuge. It's vital. Question 13. When do you think that the common supply chain announced by WHO will make PPE, that's the protective equipment, available for people in low-income countries? Sudan is under economic embargo and has near zero supplies. I won't display the emotion I feel when I read that question, but it's enormous. You know, economic embargo, border closures, and all sorts of malign behavior by people who've got wealth is stealing protective equipment away from those who need it the most, and is preventing it from reaching those who need it from most. It's a bit like deliberately targeting health facilities in war. You know you're going to hurt people. You know you're going to cause distress. Or stealing PPE or stopping it getting to people who need it is just as bad. WHO has established its emergency stockpile. That's beginning to work. Suppliers are putting the resources into it. It's just that there's always challenges with getting stuff out and getting it to where it's needed. And it arrives in a country, getting it to the people who need it and not having it stockpiled by those perhaps who don't need it. We have to shout about this. We have to say health workers dying because they're delivering care is unacceptable. All of us need to be campaigning, and WHO is doing its best. It's not incompetence by WHO. It's not incompetence by the private sector who desperately are trying to come together to support this. It's just that there are so many ways in which the chain can be broken by people, either because they are trying to stockpile because they think it's important for their own facilities, or it's being stockpiled by people who've got malign intentions who just want to make personal gain. I'm doing my best on this, but you please shout loud, shout long, shout hard. So how do I see the future of public health? Question 14, 3 minutes. Of course, as a result of this, countries everywhere are going to realize that resilience for the future is not just about resilience in the face of climate change, not just about resilience in the face of the destruction of nature, not just about resilience in the face of barbaric behavior by people with power who exploit others. It's also resilience in the face of health threats, infectious health threats. We can't say that countries haven't been warned. WHO and others have been saying that this was going to come one day. Don't know when it's going to come, but you know it's going to come. But now it'll be etched in the DNA of all nations. Public health will become center stage. I hope it'll become everybody's business, but I hope that there will be much greater respect for the people who work in public health, whether they work in communities, whether they work in nations, whether they work in businesses, and whether they work in governments and internationally. Now is a time when I'm going to appeal to every single public health person, join hands, and to be strong, not to let any kind of threatening or any kind of humiliation from preventing them from doing what is right, which is working for the health of all people everywhere. Every single life has the same value as every other life. Every single person deserves the opportunity to be well nourished, be healthy, and to have what they need to live. There should be no discrimination. Public health people are working for this to the best of their ability. They're giving advice based on the best of their understanding. It's others who perhaps are finding it difficult to accept that advice. They're finding it difficult to take really tough decisions. We have to support them. It's no good saying that they're making wrong decisions. But goodness me, now is a time when public health has to hold its head up high and has to stand up for what it believes to be right. You are all part of public health. We are all part of public health. Thank you. Public health is all of us. Thank you. Next time. Bye-bye.